I want to start, we're talking about C2 today, safe injection sites. And I want to start with talking about what this bill should be about. So what it should be about. I think it should be about saving lives. I think it should be about reducing disease. I think it should be about reducing harm. It should be about public health, and it should also be about public safety. And when we talk about what a bill should be about, quite frankly, that's, very often up to the government to decide what a bill should be about, and we take our cues from them, so to speak. But in this case, this bill is actually a response to a Supreme Court of Canada decision. So we actually know ahead of time what this bill should be about, because we can look at the Supreme Court decision, we can look at the language in it, and we can know what this bill should be about. And looking at this bill, got it all wrong, Mr. Speaker. This is not a proper response to that Supreme Court of Canada case. As you probably know, as we all probably know, this Supreme Court of Canada case is really about, it was a situation in Vancouver around Insight, which is a supervised safe injection site. And this facility actually receives an exemption from Section 56 of the Controlled Drugs and Substances Act. And so we had a challenge here, and the Supreme Court of Canada was pretty darn unequivocal in what they said about Insight, and Insight being a model for other safe injection sites. And I want to read some of the quotes, some of the pieces of this case, because that will tell us what this bill before us, C2, should be about. And it's fascinating what the court said. So the court did rule that the minister's decision to close Insight violates its patrons' charter rights, and that the minister's decision was, quote, arbitrary, undermining the very purpose of the Controlled Drugs and Substances Act, which includes public health and safety. So it was arbitrary, Mr. Speaker. I would argue in a minute in a few minutes, that this legislation is an arbitrary response. So further in this case, the court says that the infringement at stake is serious. It threatens the health, indeed the lives of the claimants and others like them. The grave consequences that might result from a lapse in the current constitutional exemption for Insight cannot be ignored. These claimants would be cast back into the application process they have tried and failed at, and made to await the minister's decision based on a reconsideration of the same facts. So the court talks about this threatening the health and the lives of the claimants. So we're talking about health here. We're talking about Section 7 rights, Mr. Speaker, that everybody has the right to life, liberty, and security of the person, and the right not to be deprived thereof. The court went on to say, and this is really important, because the court actually sets out who has the onus of responsibility here in proving a case. So the court said the minister must exercise discretion within the constraints imposed by the law and the charter, aiming to strike the appropriate balance between achieving public health and public safety. So the minister, that's where we're starting. I'm going to keep going. In accordance with the charter, the minister must consider whether denying an exemption would cause deprivations of life and security of the person that are not in accordance with the principles of fundamental justice. And then the court continues a little later on, where, as here, a supervised injection site will decrease the risk of death and disease, and there is little or no evidence that it will have a negative impact on public safety, the minister should generally grant the exemption. And I stress should. This isn't may. This isn't permissive language. The court has been very forceful here in saying should generally grant the exemption. And so what we have with this bill before us is that onus is actually being reversed. So the courts have said, look, this will decrease the risk of death. There's little or no evidence of a negative impact on public safety. And so what do we have before us? We have a bill that actually forces communities to prove the benefits, forces communities to actually do like this extensive application, proving what the benefits will be, proving what the impacts will be on the community. It's actually reversing that onus, Mr. Speaker, when the courts have been very, very clear that safe injection sites, that there is no evidence to show that this would be a negative impact on public safety. This bill forces community to come up with scientific evidence demonstrating that there's a medical benefit. Come on, we know there's a medical benefit. Letter of opinion from the ministers responsible, information about infection diseases and overdoses, description of the available drug treatment services, description of the potential impact on the site on public safety, and the list goes on. This is not an appropriate response, Mr. Speaker, because this bill should be about health. It should be about preventing death. It should be about preventing the spread of disease. So I want to talk about what a bill like this, I believe that a bill like this actually stymies the process, right? That there is one safe injection site in Canada right now, in sight, but I believe that if a community believes it needs a safe injection site, I'm having trouble with that today, injection site, they should be able to open one because harm reduction works, and the evidence shows that harm reduction works. So I want to talk about how this bill, in creating these barriers and creating these obstacles to harm reduction and creating the obstacles and barriers to actually saving lives, how it could potentially impact a community like Halifax. So Halifax does not have a safe injection site. We don't. But I would say that the people of Halifax robustly embrace the concept of harm reduction. We have many different harm reduction facilities of different forms in our community, Mr. Speaker. We have a needle exchange. We have housing first principles. We have a mobile street health outreach bus. We have a traveling methadone clinic. Halifax gets harm reduction. We don't have a safe injection site, and there are no plans. But there was actually, on the heels of this case, there was quite a bit of media about whether or not Halifax would have a safe injection site, and this court case actually allowing that to happen. And there are no plans for a program in Nova Scotia. However, even the chief medical officer, after the Supreme Court of Canada decision, he came forward and he said that he was happy to hear the Supreme Court of Canada's decision. And a quote from the Chronicle Herald at the time. He said, "We're very pleased with this because it leaves the option open down the road. If it's warranted, then it's certainly something we may consider in the future." And this is Dr. Robert Strang. So our chief medical officer has said that the decision was a wise decision. And it actually made him happy to think that we may be able to have a site like this, if needed, in Nova Scotia. So what's the problem? Why this C2 reaction? Why is it that the Conservatives have brought forward this bill that actually circumscribes or limits communities' abilities to take action and enact this kind of harm reduction in their community? Well, at the same time that C2 came out, we saw a really interesting little fundraising campaign by the Conservative Party of Canada called Keep Heroin Out of Our Backyards. And I've actually called up the website right here, and under Keep Heroin Out of Our Backyards it says, add your name if you demand a say before a supervised drug consumption site is open close to your family. Now that, on its face, seems like it might be reasonable, but then we read further into this campaign and we realize that it's all about, well, raising money for the Conservative Party, but also fear-mongering, Mr. Speaker. It's about fear-mongering. Do you want a supervised drug consumption site in your community? These are facilities where drug addicts get to shoot up heroin and other illicit drugs. I don't want one anywhere near my home. Slight parentheses here, Mr. Speaker. We're not talking about putting them beside our homes, but anyway. Yet, as I write this, special interests are trying to open up these supervised drug consumption sites in cities and towns across Canada over the objections of local residents and law enforcement. Parentheses. Really? What objections? Where are they being opened? Where is it that communities are rising up against this? There are no proposals for any of them, Mr. Speaker. And as I write this, special interests are trying to open up these facilities? Is it a special interest to want to keep Canadians alive? I don't think that's a special interest. I'll keep going. Well, we've had enough. That's why I'm pleased that we know who he is, government is acting to put the safety of our communities first. And if you could see this website, Mr. Speaker, there is an empty syringe on the sidewalk, instilling fear in all of us. Well, you know what? I biked up to my community office on Monday last week. We were at home for our riding week. And you know what I found in front of my office on the sidewalk? I found an empty syringe. I did. And I got some gloves and I picked it up, and a few doors down is the North End Community Health Centre, and they have a Sharps disposal container, and I dropped it off there. And so it's real, right? The idea that people are using intravenous drugs on our streets is real. But you know what I actually think is the threat to public safety here? It's not it's not safe injection sites. It's the fact that there isn't a place for people who have addictions, who may be homeless, who may be struggling with a myriad of other issues. There is nowhere for them to go that is safe and supervised. And so I talked to Metro Nonprofit Housing Authority, which is down the street from my office, and they talk about finding needles in their bathrooms. Why? Because that's where people can go. It's safe and warm. It's the safest they can get. And it's warm and it's private, and they can close the door and they can do their drugs there. Is that appropriate? I think that's more of a threat to safety than a safe injection site. There's a needle drop, a Sharps container behind my office that a local community group put in so that people, when they're doing drugs, it's kind of a dark alley, right, and stuff's going on there. We need to acknowledge what's happening in our communities. So they put in a Sharps disposal container. And what happened? People actually broke into the box to get the needles, Mr. Speaker. They broke into it. That's not harm reduction, to actually create a supply of dirty needles for people to break into and share. But that's the reality of what's happening in our communities, Mr. Speaker. There's a local cafe, it actually closed a couple years ago, but there was a local cafe down the street, maybe 4 doors down from my office, and they had to put a Sharps container in their bathroom. I think that is more of a threat to my safety, having needles in my local cafe, than a safe injection site where it's supervised, where it's clean, where the needles are clean, where the needles are disposed of properly. I would much rather have a safe injection site beside my office than know that there are dirty needles behind my office that people are reusing. This is about safety. This is about public health. And I want to get back to public health for a second, because nowhere in this bill is there even a mention of public health. I find that shocking, Mr. Speaker. And when we're talking about health, when we're talking about what this bill should be about, saving lives and stopping the spread of disease, well, we have stats. We have real hard evidence from Insight, hard evidence. And do you want to hear what it is? So the rate of overdose deaths in East Vancouver has dropped by 35% since Insight opened. That's pretty good evidence. Something's working. Harm reduction works, Mr. Speaker. There have been, in a study over a 1-year period, no fatalities from those injections. In 1 year, over 2,100 referrals were made to Insight users to addiction counseling or other support services. I can tell you there's no referral service behind my office. People who used Insight services at least once a week were 1.7 times more likely to enroll in a detox program than those who visited infrequently, and probably a heck of a lot more than the folks who were behind my office. There was a significant drop in the number of discarded syringes, injection-related litter, and people injecting in the streets 1 year after Insight opened. Injection drug users who use Insight are 70% less likely to share needles. That is a staggering number. Reducing needle sharing has been listed as an international best practice to reduce the rate of HIV and AIDS. And Insight users are more likely to seek medical care through the site. This means less trips to the emergency room and an improvement of health outcomes. Probably heard a pretty big sigh there, Mr. Speaker, as I was reading the evidence, because the evidence should speak for itself, but it's not, because we have C2 in front of us. It's actually making it harder for people, harder for communities to have this kind of success story in their community. It's all about evidence, Mr. Speaker. It's all about evidence. Evidence shows that harm reduction, like safe injection, works. And I'm really proud of the harm reduction initiatives in my community. We do have mainline needle exchange, where folks can actually get clean needles. And you know what? Maybe get referred to some services. We do have Direction 180, which is a methadone clinic, and they have recently had this huge success of being able to buy a mobile bus to then actually get to some of the communities that aren't in the north end of Halifax and make sure that people get their methadone. These are folks who are trying. They're trying to deal with their addictions. They are trying to better themselves. So we need to have these harm reduction programs in place for them so that they can succeed. Because what's the alternative? Death? MOSH, Mobile Street Health. It's a van that goes around to where people are, under bridges, at the, in fields, at the homeless shelter, to where people are to give them the medical treatment that they need. This is what we need, but unfortunately, the government's not interested in harm reduction. I'll give you a quote from Cindy McIsaac. She actually runs Direction 180, our methadone clinic, and she was quoted as saying, "Ottawa's new approach is to criminalize what should still be seen as a health issue," says Cindy McIsaac, Executive Director of Direction 180, a methadone clinic in Halifax. "You can't even use the term harm reduction anymore when applying for federal funding. The taps have been turned off." So, this bill is all about creating fear. This bill is not about health. This bill is not about helping people get better. C2 is a bill that's about power. It gives power to the minister, and it disempowers the most vulnerable members of our society. But there is a more powerful argument against this bill. Those are the voices of members of my community and communities across the country who recognize the value of safe injection sites as a harm reduction program, and they want the ability to set up a similar site where needed. Mr. Speaker, safe injection sites are one way that we can help save lives, treat people who suffer from a disease, help people reorient their lives, improve the quality of life for community members, and make our cities safer for everyone. What we need is less barriers to programs like this bill would create, because the government is getting in the way of caring for those people that need the most help. I want to emphasize that addiction is not a choice. It is a disease, and those who suffer from it should be treated with the dignity and the respect that we give to other people suffering from chronic illness. When we speak about safe injection sites or harm reduction programs, there is very often a human element that gets left behind in these debates. And I want to make sure that we do actually talk about that human element here in the House, Mr. Speaker, because people who suffer from addiction are also suffering from stigma and discrimination that follows that disease. And this bill, I think, lacks that understanding of this human element. It makes it more difficult for safe injection sites to be established in our communities and for individuals battling addiction to receive compassionate care. When in getting ready for this bill, I did speak to folks at Brunswick Street Mission and Mainline Needle Exchange, and they have said that the people who need help in my community are increasingly younger people living in the shelters. They're inadequately housed, and they suffer from severe health issues, including mental health issues and mental illness. And the problems that face people who suffer from addictions can't be isolated. They can't be isolated from housing, from health, from poverty, education, and addiction. They're all inseparable problems that can overwhelm anyone. And safe injection sites are an important part in dealing with these issues holistically. At Insight in Vancouver, it's not just a program about drugs. Safe injection sites are about helping people through providing a safe space, peer support services, and health services. And unfortunately, this bill doesn't look at that whole picture, Mr. Speaker. It makes safe injection sites harder to establish across the country, and it makes it harder for our communities who actually want to tackle these and other connected issues. With no safe injection sites and no safe spaces for people fighting addiction, this means that we are pushing those people to the very margins of society, which exacerbates poverty and homelessness, and it exacerbates health and safety issues for our communities. Thank you very much, Mr. Speaker.